Where is your spinal pain coming from? Well, three common culprits are number one, pinched nerves or sciatica. Number two, the small facet joints that are paired on either side of your spine at every level of your spine from your neck down to your tailbone. And number three, the two large sacroiliac or SI joints at the bottom of your spine. Sometimes your pain is coming from just one of these areas, but frequently we find that there's more than one contributor. And figuring out spinal pain is tough because all these areas can refer pain into similar parts of your body. If you're having spine pain or neck or back pain, it's important for you to familiarize yourself with these three culprits, because in doing so, you can become a better participant in your treatment. Today, let's look at the sacroiliac joint injection. Here is a good illustration of the sacroiliac joint, which is also called the SI joint for short. You have one joint on each side, which is responsible for the very important task of transferring all of your weight from your spine to the ground, going through your hips and your legs. It also has to stabilize the forces coming from the ground up to your spine. Here's the joint again. Because of the tremendous forces traveling across this joint, you have very strong ligaments surrounding it to help keep it intact. If one hip gets higher than the other, or your gait changes due to a bad knee or ankle or back pain, your SI joints can get overworked. It's also common to have SI joint pain after car accidents because your seat belt pins your pelvis into the seat, but your lower spine can move a bit, stretching the SI joint ligaments. Notice the illustration of the areas that SI joints can send pain. There are two challenges with identifying SI joint pain. Number one, we do not have a reliable test for SI pain, or for that matter, any pain from the spine. We can get x-rays and MRIs, but they just show your anatomy, which doesn't correlate 100% with your pain. In a physical examination, we can press on your back or move your legs a certain way to try to reproduce the pain, but these tests are not 100% accurate. Number two, pain from the SI joint can appear in areas of the low back, hip, buttocks, and legs that are also consistent with pain from a bulging disc or pain from the small facet joints in your spine. This is a joint that usually responds very well to a steroid injection. And more recently, we've been excited to learn that platelet-rich plasma has been shown to be very effective as well, harnessing your body's own healing potential to reinforce the joint naturally without the use of steroids. We've been helping patients treat SI joint pain for 20 years and would be happy to help you too. No referral is necessary, and we accept most insurances.